Hey everyone, my name is Yevgeny Peregudov, and today I'll be discussing ethical communication in allied health research. I'll cover the principles of scientific communication, ethical considerations in human research, communication challenges, and how to communicate effectively with patients and healthcare teams. What I want to start with are principles of scientific communication. According to Bucamp and Childress, and also World Medical Association, first, scientific communication is built on few key principles. These include accuracy, clarity, transparency, objectivity, and reproducibility. As healthcare professionals, it is our responsibility to make sure that the information we share is evidence based and free from bias. Communication should be clear and easy to understand, especially when sharing complex medical terminology. Transparency is critical, and we must openly report methods, results, and any limitations in research. The next thing I want to talk about are ethical implications in human research. When conducting research involving human participants, several ethical principles must be followed. According to American Medical Association and also U.S. Department of Health and Human Services and National Institute of Health, informed consent, beneficence, respect, and confidentiality are all important parts of human research. Informed consent you have to achieve every time you about to perform a procedure. Beneficence has to be there as well. It has to be good for the patient's well-being to do that study, and of course treat every patient with respect and honoring their autonomy. And also confidentiality, everything that is collected through the study has to be kept confidential and protected. The next thing to consider are ethical issues in communication. There are also ethical challenges related to communication and research. Again, according to Bucamp and Childress and also World Medical Association, miscommunication can lead to patient harm or inaccurate study results. For example, if risks are not clearly explained, participants cannot give their informed consent because they didn't get the full picture. Deception or withholding information can also raise serious ethical concerns. And additionally, cultural differences and language barriers may affect communication and imply complications in those fields. Healthcare professionals must be aware of these challenges and strive to overcome them. The next thing to mention is effective communication with patients and other healthcare teams. Effective communication is essential when working with patients, families, and other healthcare providers. With patients, it is important to use plain language and avoid medical jargon and show empathy. According to Agency of Healthcare Research and Quality, active listening really helps to make sure patients feel heard and understood. And when communicating within healthcare teams, tools like SBAR, which stands for Situation, Background Assessment, and Recommendation, can improve clarity and efficiency within the team. Next thing to mention is writing formal correspondence. Strong writing skills are important for communication, research, and clinical information. According to Grand Canyon University, which aligns with this course material expectations for professional communication, formal correspondence should be clear, organized, and professional. It should include a clear purpose, organized structure, and evidence-based to support key points. Maintaining patient confidentiality is essential. In conclusion, ethical communication is an important part of every allied healthcare research and practice. By following these simple key principles and maintaining clear, honest communication, healthcare professionals can improve patient outcomes and uphold ethical standards. Thank you for listening.